All right. Thank you everybody for coming. I know it's very cold today, and the road getting here was kind of rough. But my name is Andrew Mertens from Iowa for Healthcare, and I just wanted to. I'll start out this press conference here. Since 2002, Iowa for Healthcare has been fighting for the hundreds of thousands of people in this state that go every day without health insurance. But they are not the only ones suffering in this nation's healthcare crisis. Not by far. There are so many Iowans and Americans that have health insurance, but are feeling the burden of skyrocketing healthcare costs get heavier every year. The cost of insurance is keeping America's big business from competing globally, and are now keeping America's small businesses from even surviving. As you will hear in the Access Project report, Iowa family farmers, whose products we greatly depend on, are feeling the pinch now worse than ever. Years ago, a farmer might have to sell a piece of his land to pay for medical care. Now he'd have to sell the entire farm. It's inexcusable that in the richest nation in the world, so many people can't afford access to health care. The American healthcare system is in need of real, comprehensive reform, and this change needs to happen at the national level. Today we've released our presidential candidate healthcare plan comparison to our 32,000 healthcare voters in the state, and asked them to get out and caucus for healthcare reform, to caucus for the candidate that they think has the best plan to bring quality, affordable healthcare to every man, woman, and child in this country. The longer we wait, the worse it's going to get. We must act now, and we must make reform a reality. We're asking all of our healthcare voters to get out and not only caucus for healthcare, but then in the general election, make sure that we elect the healthcare-friendly candidate. Now I'd like to introduce Bill Latero from the Access Project, who's going to talk about the brief itself.
Thank you. Good morning.
Good morning.
As Andrew mentioned, my name is Bill Latero. It's a chilly day, and these facts, in fact, should make you act quite chilling in and of themselves. People's overall health expenditures are largely determined by how they buy insurance. Through government-sponsored programs, off-farm employment, or the individual non-group market, people who purchase on the individual market pay at a much higher rate. What you're going to find in these findings is that farm families, are purchasing on the individual market at 37% versus 8% of nationally figures. That's a staggering difference of cost difference, because the cost on the individual market is significantly higher. But we have a study that was inclusive of this state as well as the other Great Plains states. In this state, the total number of people surveyed in partnership with the USDA was 268 farm families. They were 91% insured. They were Caucasian, mostly married, 45 years and older. And of those people, 1 in 6 said that healthcare expenses contributed to their financial problems. 1 in 8 had outstanding medical debt. The Iowa family farm average spends $6,500. However, the differences become stark when you look at the distribution of those 268 families and who had to buy on the individual market. Of those who bought on the individual market, 62% of those families surveyed bought on the individual market. And they had high premium, high deductible plans. That average cost for that high deductible, high premium plan is $10,850. That exceeds 7 to 12 to 16% of their income. Now, their income range was between 40 and 100,000. These are middle class, hardworking people. And when those kind of cost structures start hitting at their ability to take on other costs, you have a real problem here. Because what it's really just focusing in on is the fact that if a middle class, hardworking, fully insured family is having a problem and is exceeding 10% of its income, what is happening to everybody else in rural America? What happens when that farm family cannot pay those bills? 20% had medical debt. That means they cannot pay those bills. That goes onto their credit scores. Those credit scores are then marred. They then are subject to struggles to get an operating loan or an inadequate interest rate that will affect them in severe ways. They can become prey to subprime lending, and we know what's happening in the mortgage markets here. So, all in all, I think that why we did this study, the Access Project is a national research center that decided that we wanted to show that by studying farm families, that we could reveal the particulars. Everyone knows the healthcare system is a mess, but we wanted to reveal the particulars of that mess so that when you're talking to your candidates, ask for particulars, solutions. Cost containment is a large issue. If those costs today, in this year, are ranging between 7 to 12 to 16% of the income, with cost increases year in, year out, 9%, 12%, 16% increases in the medical costs. Well, what happens next year to that? That's just a train wreck, and there's no end in sight. We need a candidate that's going to turn that around, stop that train, and turn it around to a more rational system.